Good afternoon. This is 1 p.m. midday news when we're going to update you about the news that related to COVID-19 outbreak in Thailand. We try to do this every day is possible. Sorry. Today we'll of course update you with the latest recorded case in Thailand and also Chiang Mai to open its night market this week. And the expert try to explain why medics and elderly are vaccination priorities. And also the problem with the borders of Thailand the border will be intensified due to the COVID-19 spread in neighboring countries. And also the myth buster from WHO, vitamin and mineral supplements cannot cure COVID-19. Let's start with the news from the press briefing of the CCSA today. We are going to show you the screen of CCSA. This is the press briefing today that Dr. Tawisin has made the press conference. Today we can see that it's himself. Yesterday it was Dr. Pismai, which is the assistant spokesperson for the CCSA. So Thailand today recorded 171 new COVID-19 cases, the majority of which were locally transmitted, with 13 imported cases, bringing the total of Thailand cases to 12,594, of which 8,357 are from the new outbreak. Dr. Tawisin Viswayotin said that there are 3,168 people receiving treatment right now, while 9,356 have already recovered. He said that the rate of infection is stabilizing but not yet falling, and most new infections are being discovered through proactive screening. Samut Sakhon is still the province with the highest number of cases recorded, mostly among immigrant workers. The total number of infections in the province since the new outbreak began is now over 4,600, followed by Chonburi at 647, Bangkok at 606, and Rayong at 568 cases. Right now, there are still 16 provinces with no infections being reported. And Dr. Tawisin that give praise to all these provinces and tell them to keep up the good work. Anyway, there are 31 provinces that have seen no new COVID-19 cases in the past 14 days. So that is also a good news. Dr. Tawisin focused on the situation in Samut Sakhon province, saying that the more proactive they are, the more cases they find. Officials now aim to screen 600 factories per day, 50 people per factory, hopefully covering all factories by the end of this month. So in Samut Sakhon, there are thousands of factories in the province that are small, with no more than 100 workers. The CCSA spokesperson asked the factory's owner not to worry and to cooperate because the Labor Ministry has already announced that any workers entering Thailand legally or not who have been in Thailand since before December 29th last year are now allowed to work legally. Dr. Tawisin said that the situation in Bangkok is, however, worrisome. The area in which most cases are being found is in the west of the capital and related to night entertainment venues and possibly connected to the outbreak in Samut Sakhon province. He also mentioned the southern provinces bordering Malaysia, which are recording thousands of new cases daily. He said that the area has to depend on health volunteers and local public health officials being vigilant. And regarding the tracing application, at the end today, he was talking about Mochana tracing application. He praised the businesses that received 4.9 star reviews from the application's users. with convenience stores topping the scores. If you were looking at the press briefing, you will see that across the board, every province is on the top rank. The convenience store is the number one. They get the highest score. In some provinces, such as Nakhon the convenience store received more than 95, I remember correctly, percent for their for their public health measures, disease control measures. So they are doing pretty good. And the application has now been downloaded almost 8 million times and has about 6.5 million registered users. So that is better in terms of the ratio of people that actually using it and the people that downloaded it. Dr. Tuvison also reiterated Prime Minister's message the other day that the government will wait until they are sure the vaccine is safe before they start the inoculation program. So we will receive the first batch of vaccine from China next month in February, 200,000 doses, which the government said that they will inoculate the medics first and the high risk group, and then there will be more vaccine to follow in coming months. So hopefully by the end of this year, half of the population will be uh, vaccinated twice. But even though some experts suggest that maybe we should just give the vaccine to medics and elderly group twice, but then the rest of the country cover everyone, get the first dose first, and then the second dose in the following year when it's broadly available. But for the mass inoculation program, the government hasn't really finalized the program yet. So we don't know yet what the government would want to do. Now, let's talk about Chiang Mai. Chiang Mai just make an announcement that they will open the night market this week. This week, I mean tomorrow, they will start. Uh, they will allow the night market and similar activities to open. Let me show you the announcement. They have the announcement showing last night. Chiang Mai is preparing to open its popular night market after no new COVID-19 cases have been recorded there for 6 consecutive days. Chiang Mai Governor Charanrit Sangwonsat and the Provincial Disease Control Committee resolved to ease restrictions on social activities and will allow flea markets, night markets, and walking streets to open from Wednesday, January 20th, which is tomorrow. The announcement stated that the marketplaces must, nonetheless, adhere to strict disease control measures. Chiang Mai ordered all markets and similar activities to close since January 6th. Back then, it said that all these markets has to close for 14 days, but now it's not 14 days yet. But because they have no new cases for 6 days now, they think it is safe enough to open all this, to let all these economic activities going, and everybody just have to adhere to the strict measures. So that is, I guess, the good news for the business operators, especially small businesses that involve in these markets in Chiang Mai. Now to the next news. Let me go to the comment first. Um, there are viewers from Bangladesh and the owner of Samad World Gallery. Hi, nice to meet you. Anyway, let's go to the next news. Next news, we actually get a quote from Dr. Yong Puvarawan, which is a very famous, well-known virologist of Thailand. He usually uses his Facebook page as the channel to communicate to the public. Let me show you his post. There is his post. He said that he is trying to explain why Thailand must prioritize COVID-19 inoculation of medical personnel and senior citizens. Dr. Yong, posting on his Facebook, said that the studies have shown that COVID-19 vaccines are able to prevent severe symptoms and therefore reduce fatalities. But in short term, he thinks it will not be able to provide sufficiently widespread immunity that will help contain the outbreak yet. He says that he believes that inoculating the working age group, who are usually asymptomatic or suffer mild symptoms, would not help to contain the spread of the virus because they are still able to infect others. He explained that giving vaccines to medical personnel and senior citizens as a priority will help because though they are infected, they will not fall severely ill, according to the study. So, like I said, let's see how the government plan roll out. It's not finalized yet, but we know pretty soon. Now, let's go to the next news. We still are going to talk about COVID-19 vaccine. Like I said, that we have first shipment coming in uh, next month. Sorry, next year is too long. Next month we will have our first vaccine coming in, and let me play that for you so you don't get bored seeing only my face. So Thailand will get its first emergency shipment from COVID-19 vaccine this week, ahead of the schedule, and vaccinations should be able to begin in February, giving it get approval from the FDA Thailand. Dr. Opat Kankawinpong, which is the Director General of the Disease Control Department, said yesterday evening. He said that the manufacturing company, which he did not name, had already submitted detailed information and samples of their vaccine to the Thai Food and Drug Administration for examination and test of its efficacy and safety. He said that the vaccine is expected to be approved by the Thai FDA, that the first lot of the vaccine will be in Thailand within this week, that is very soon, and that vaccination can start in February as planned. Dr. Opat also said that after mass vaccinations, there will be a follow-up system to monitor the condition of those inoculated for any negative side effects, adding that if there are a committee adding that a committee will investigate each case to determine whether the symptoms are linked to the vaccine. And he indicated that if it is proven that they were not related to the vaccine, then the vaccination program will continue. But that if there is any doubt regarding the safety of the vaccine, it will be suspended until it is proven safe to use. So, since the COVID-19 vaccine is new, he said that the safety is a top priority, hence the need to test its efficacy and safety and to monitor the result. While describing vaccine as just a tool to contain the virus, Dr. Opat said prevention is still necessary, though the wearing of face masks, regular hand washing with sanitizer, and social distancing, and also now, of course, they adding the using of the Moshana tracing app. Hopefully, be able to help with the contact tracing if any case there are infection in the area that you visited. Now, let's go to the next news. The next news is about border control that is ordered to intensify due to the COVID-19 spread in neighboring country. Let me see. And I will show you the border, and also there's the border. That was the announcement about the border control. The Deputy Director General of Thailand Disease Control Department, Dr. Sopon Iemsrithawan, said that many neighboring countries are seeing a large increase in new COVID-19 infection, and he was talking about Malaysia that recently reported over 4,000 new cases, bringing the cumulative total to more than 155,000, while Myanmar found almost 500 new cases, raising their total to over 133,000 cases. Thailand therefore needs to continue with its stringent measures along the borders, such as preventing illegal border crossings and proactive screening, especially of migrant workers. A few days ago, the provincial police in Sadao district of Songkhla province and troops from the 5th Infantry Regiment Special Unit arrested 8 Myanmar migrant workers who snuck into Thailand hoping to return to their home country through Ranong province. Health officials screened the migrants and 2 of them were found to have a fever, a cough, and a sore throat. Both have been sent to Sadao Hospital while the remaining migrants were detained at Sadao Police Station. But the news also reported that all these 8 people look very fatigued and exhausted. They believe that trafficking ring that snuck them in the through the border of Thailand actually probably intend to leave them there in the forest, and they probably wouldn't know where to go next. Anyway, meanwhile, the permanent secretary of the Ministry of Interior, Chatchai Promlet, has ordered all provincial governors, especially the border provinces, to intensify the already strict measures to prevent illegal border crossings. So if they come in legally, they get into the system, into the quarantine process. It will also help us to be able to contain this outbreak easier, at least with the import cases. But if there are more illegal border crossing, it will be difficult for us because most people that enter Thailand illegally, they don't isolate themselves so far. So hopefully we'll be able to contain this outbreak pretty soon. Like Dr. Tawisin said, that the trend of new infections is stabilizing, but it's not falling yet. So we have to just uh, keep doing what we are doing. I think it's looking good already that everybody just wearing masks, keep washing their hands, stay distance from each other, and try to stay home as much as possible, reduce the movement as much as you can. Now, let's do this myth busting from WHO. I think this is something interesting that I should share you every day or most often as I can find something I think interesting. So this is, let me make it in a big screen. This is on the WHO website. It tried to bust the misinformation that has been floating around the internet right now that vitamin and mineral supplements can cure COVID-19. The fact is, it cannot cure COVID-19. Micronutrients such as vitamin D, vitamin C, and zinc are critical for well-functioning immune system and play a vital role in promoting health and nutritional well-being. There is currently no guidance on the use of micronutrient supplements as a treatment of COVID-19. However, WHO said that they are coordinating efforts to develop and evaluate medicines to treat COVID-19. So, if the supplements might help you to get enough vitamin or what you need to your body, but it's not a cure for COVID-19. So if you suspect that you are infected, uh, just go consult your doctor, but tell your doctor or that medical institution before you arrive that you suspect that you might have COVID-19 or you are at risk group, so they know how to handle your arrival. And that's it for um, the news today during the day about the update of COVID-19. Hopefully, we able to cater to you some interesting facts and news. And we'll see you again at 7 p.m. today. Me with Nat Bunnak on the update of the day of the COVID-19 outbreak in Thailand. And throughout the day, you can follow us on Facebook, you can follow us on Twitter, and also on our website. We will have all the updates, everything that's going on in Thailand, not just COVID-19, something about politics, or even the day that the weather gets so dusty, PM 2.5 going through the roof. We also have those news for you. So don't forget to check us out on the website, thaibsworld.com. on our Twitter, just search for Thai PBS World, and on our Facebook, just search for Thai PBS World as well. And that's all the news I have for you in this edition of News Update. And see you again at 7 p.m. สวัสดีค่ะ